And we are live. Pause that. We're live here at the Zoomerplex in Toronto for another CARP national webinar. I'm Anthony Quinn. I am the Chief Community and Benefits Officer at CARP, and we're delighted to welcome all of our CARP members and viewers from across the country. I had looked at my screen just before we started, and we were well over 600 attendees joining us right now. Looking forward to sharing lots of valuable information with you today. And we are talking about getting the most out of your medications and getting the most out of your pharmacist. No better person to ask about how to get more medications and pharmacists than from a real pharmacist. So we are delighted to have Peddie with us. Good afternoon, Drew.
Good afternoon.
Drew comes to us with over 25 years experience in pharmacy, graduate of the University of Alberta. And you've had roles in community practice, in management, and an ownership of pharmacy as well, and currently in the corporate world.
That's right.
And you come to us as a designated manager of Health Depot by GreenShield.
Correct.
Well, welcome, Drew. Thanks for joining us today.
Thanks for having me.
So a lot of the concerns of members today are about the shortages in the healthcare field, particularly related to shortages of doctors and access to a family doctor, or even having a doctor in their community at all. Talk about what the role of pharmacists can do to help alleviate that.
Yeah, well, we know that there's 6.5 million Canadians right now who don't have access to a family physician. That's up from 4.5 million Canadians just since 2022. The shortages just continue to happen in the healthcare system, and ability to access care is an issue. A third of patients, a third of people in Canada seeking medical help can't see their family physician within a week. And another 17% of patients have been trying to find a family physician for a year and haven't been able to. So we've got half of Canadians can't regularly access their physician.
Ed, you live in London, Ontario, I understand. We're in Toronto right now. It's a lot different in different parts of the country. We luckily have access to walk-in clinics or other opportunities. What about the rest of Canada where the problem is more acute?
Well, especially in rural Canada, we're seeing the development of healthcare deserts where patients don't have any hope of getting access of care anytime soon. In my local area in southwestern Ontario, I was just reading an article about a local physician in a very small community who will be retiring this year. There's been no ability to replace him. There's 1,800 people that he has on his roster that will have no physician, and they're 2 hours away from a center of extensive medical care.
So perhaps that's where pharmacists can step in and help bridge that gap. Those numbers are really staggering. So what does this mean for pharmacies and pharmacists in Canada?
So it's been really interesting since COVID. I think pharmacists have always been seen as a first point of contact for the healthcare system, and patients have always been coming to us because we're convenient and we're easily accessible. But what we are seeing is since COVID, pharmacists stepped up, COVID testing, prescribing for COVID vaccines, and now RSV vaccines. So our scope has continued to expand, and people are now seeing us as a good, valuable source of primary care. And that is putting some strain on the pharmacy system too. Some places, aren't making the same investments and trying to ensure that there's enough regulated staff to be able to keep up with all of that demand. At the Health Depot, we are doing that investment, and we're trying to make it so that we have pharmacists who are trained and able and conveniently accessible to access care for.
Well, the Health Depot is an online pharmacy. It's a virtual pharmacy. Tell us how that works and how people access the Health Depot.
So it can be as simple as picking up the phone, but we also use virtual video to connect with our patients. Really, it's about convenience. It's about not needing to get out of your bathrobe and off your couch and stand in a waiting line with 12 other people and blaring music and everything else. It's about making it convenient and making our care accessible, and it's easy to do.
Well, for older Canadians, perhaps even more of a benefit when you can not have to get out of the house or traverse distances, expenses to get to a pharmacy.
Absolutely.
Be in line, and then the chances of perhaps picking up something while you're in that condition.
100% agree. And in addition to that too, it actually offers a new level in privacy in terms of your care. So being able to get care directly in your home is a lot more private than some traditional bricks and mortar circumstances.
And there are many pharmacists across the country, but do we have enough pharmacists to meet this need right now?
I think that we continue to see an expansion of scope. We continue to see patients who don't have primary care physicians or have difficulty accessing them. So the demand for pharmacists is going to continue. We have new schools of pharmacy opening. We have increased capacity. We have immigration actually helping us to, bring pharmacists in who then get properly tested and vetted and everything else to be able to practice. So, of course, I think like any healthcare industry, we are facing a bit of a pinch right now in terms of labor, but there are many things in place to try and ease that up over time.
Certainly not the same pinch as what the doctors and the shortages there are feeling now.
No, so on top of all the population growth putting demands on their time, we're also seeing physicians who are increasingly disenchanted with family practice and the administrative burden of that, dropping out at record rates, retiring, closing their family practices. And then on top of that, we're not graduating that many more physicians than we were 10 years ago. In 2022, there was 2,500 listings for physician recruitment on government websites, and yet only 1,500 students who graduated that year were looking at opening family practice or going into family practice.
You mentioned the expanded scope of practice. Now, what does that term mean, and what more can pharmacists do now than they used to be able to do in the past?
We saw a lot of it occur during COVID, when pharmacists became testers for COVID and prescribers of medication to treat COVID and vaccinators. But on top of that, one of the biggest things we've seen is the implementation of what's called minor ailments assessment and prescribing. So this is pharmacists using their knowledge and capability and skills to assess people coming into the pharmacy who have perhaps minor conditions, things like uncomplicated urinary tract infections or some acid reflux or acne or cold sore. Pharmacists being able to assess that condition and then prescribe for it as well.
So from the patient point of view, I don't have to either wait in line or wait months or weeks for an appointment with my family doctor. I don't have to get in line with a physician I'm not familiar with in a walk-in clinic. I can go to a pharmacist and have them diagnose and also administer or prescribe medication directly to me?
That's exactly right. So in Ontario, for example, there are 19 conditions now since October 1st that pharmacists can assess for. In some provinces, there's upwards of 30 conditions. And then in provinces like Alberta, pharmacists there can realistically, they can prescribe for any medication, any prescription medication that is necessary, provided it falls within their scope and their abilities and their competency. And what that's really doing is helping to take some of the burden off the rest of the healthcare system. I think it's important to note too, with a lot of these conditions, they're things that we've been assessing for a very, very long time. I've been out of school for 27 years. 27 years ago, we were taking courses on disease states, we were taking courses on pharmacotherapy, we were taking courses on assessment. And we're not talking about pharmacists assessing and prescribing for cancer or Parkinson's disease or anything like that. We're talking about things that people were already coming into pharmacies for. Half the time they were saying, what is this rash, or I've got a red eye, what's the issue here? I was asking a number of questions to sort of determine what it was. And then oftentimes it's just having to say, well, now you're going to go and you're going to go down the road and you're going to wait for 2 hours in the waiting room, and then you're going to get a prescription, and you're going to come back here, and I'm going to fill the prescription that I would have told you you're going to get anyway, right?
I was just thinking there could be some stubbornness on the part of patients to go see their family doctor. Do you find that they're more willing to go in and perhaps speak to their pharmacist or say, would this work for me for what I have, and then you could sort of be that entree into seeing a family doctor?
Yeah, absolutely. So again, pharmacists tend to be very, very accessible and conveniently located, and now in scenarios like ours where we're digital and online, it's easy to access that care. And so we are seeing patients coming to us who are being told, I'm sorry you have this symptom, but we can't get in to see you for 7 days or more. Oftentimes these are conditions that need treatment before then.
And they could get worse if they don't have that quicker
Absolutely.
treatment,
Clinical studies have shown of clinical practice research in pharmacy that when pharmacists are involved in minor ailments assessment and prescribing, patients get seen sooner, we reduce wait times in emergency rooms and walk-in clinics, and we get better health outcomes because patients are being treated earlier.
With this new expanded scope of practice for pharmacists, is there concern that your profession could be stepping on the toes of those who are traditionally providing those kinds of responses through family doctors or nurse practitioners, other parts of that medical system? Is there a conflict between them?
So I think it's really important to note that this expansion in practice was not done in a vacuum at all. Places like the College of Physicians and Surgeons of Ontario, the College of Nurses, they've all been consulted. The public was consulted when we were looking at expanding the scope, and the ministries of health are really the ones who have been stick handling the whole thing. Has there been debate? Absolutely. But pharmacists are highly trained. We're also given a lot of tools and resources that help to determine when it's appropriate for us to assess and prescribe, and then when it's appropriate for us to refer. And the nice thing about referral is, should you be lucky enough to have a family doctor, if you come into the pharmacy and we assess you and we determine that there's something there that is outside of our scope to handle, we send a letter to your physician saying, hey, we saw this person today, here's what they have, here's my concerns, and I've referred them to you to be assessed.
And would you direct someone directly to the ER as well if you saw a condition that was perhaps requiring
yeah, I
that?
mean, that's happened, working in community pharmacy for years. I've had people who've come to the pharmacy to say, like, I think I'm having a heart attack, which is, don't ever do that. Don't ever go to the pharmacy. But yes, we would refer, if it's appropriate to refer to an emergency room, we would do that. If it's more something where maybe a walk-in clinic could handle it or an urgent care clinic, we would recommend that. But sometimes too, we're recommending no, like wait the week if that's what it takes to get into your physician. And oftentimes by us communicating that to your family physician, it also can increase the urgency a little bit as well.
So generally, what is the larger implication to the entire healthcare system for this expanded scope of pharmacy?
It's really about taking pressure off the system. So if you think about a busy family practice and you've got a waiting room full of people and 3 or 4 of those people are in there because they've got really watery, itchy eyes because their allergies are really bad, and then you've got one patient in there who's a type 2 diabetic with congestive heart failure and their ankles have been swelling for the past week, where do you think you want to spend your time? What's the most important patient in there? And so it's being able to free up time for physicians and nurse practitioners to be able to focus on that patient while the pharmacy can offload some of the more minor conditions that need to be treated.
We're here in Ontario, a little bit different across the country. Just can you outline generally what physicians' roles are in different provinces? Not into specifics, but generally, how is it different? Because at CARP, from CARP's point of view, we want to be elevating all boats. Right across the country, make sure people in every province have the best access to medical care. So what's the lay of the land right now?
So in terms of what we've been talking about, minor ailments, it's pretty comprehensive across the country now. Pharmacists in almost every province have some ability to prescribe and assess for certain minor ailments. Those numbers are growing. There are some provinces on the East Coast, for example, Quebec, where there are over 30 conditions that pharmacists can prescribe for. And in Alberta, it's wide open. The pharmacist technically can prescribe for any condition they're comfortable in. There's a bit of a mishmash of regulations and reimbursement across the country. And so a place like, the Health Depot, we offer this service in Ontario, and we're looking for ways to offer this service across the country as well.
Just wanted to remind everyone, in the chat box on your webinar, you can ask a question. We can't answer personal healthcare questions, obviously, but if you have a question about the role of pharmacy or getting more out of your medications, please write it in the chat box and I'll try and get to them as soon as we can. You mentioned minor ailments. You mentioned vaccination. So CARP is obviously advocating on behalf of our members for improved and equal access to vaccinations, especially eliminating the out-of-pocket costs for vaccines. We're talking about shingles, about access to the high-dose flu shot. What is the role of pharmacists in ensuring vaccinations are up to date for adults?
So in terms of public vaccines, obviously COVID, flu shots, we've been partners with the healthcare system for a while now, and that has really improved our ability to administer those vaccines to anybody according to the various eligibility criteria. But a really big change occurred over the last 5 years as well in Canada, where a lot of vaccines have been rescheduled. So they've been scheduled away from prescription and on to what's called Schedule 2, which means you don't require a prescription in order to access that vaccine. Pharmacists can do the assessment, provide guidance as to what vaccines you're eligible for or should get, and then we can administer those vaccines as well, and we no longer require a prescription. Reimbursement can be a little more complicated. There's, again, a bit of a mishmash out there in terms of...
Sorry, reimbursement to the pharmacists themselves, not to the patient?
No, more so to the patient. So for example, Schedule 2 vaccines are oftentimes out of pocket without a doctor's prescription according to the requirements of a specific plan, for example. And so that can still create a bit of an issue. We can send faxes to the doctor and try and request prescriptions for these vaccines to help with reimbursement. That's not always appropriate and it doesn't always work, but it is something that we can do. And then on top of that, we can administer vaccines as well.
So we hear a lot about the idea of polypharmacy, people taking too many prescriptions, perhaps not taking enough or adhering to their prescriptions. How does a pharmacist act to support the patient in checking their medications, what they're taking and what perhaps they shouldn't be taking?
So there again, our expanded scope of practice, and I look back to something that occurred over 10 years ago now, which was the advent of medication reviews. Those in Ontario might know them as meds checks, for example. A medication review is really an opportunity to do a checkup on your medications, spend time with your pharmacist, go over specifically all of the medications that you're taking, not just the one that you're in to see, a healthcare practitioner about that day, but everything that you're taking, including over-the-counter medications and supplements and natural products, and really talk about how you're taking them. Are you getting the most benefit from them? Are you having difficulties or issues with them? And then being able to help solve some of those problems as well. So that's the best way is to have a medication review done on a regular basis, at least annually, to spend that time with a pharmacist.
And does it have to be a patient who has 5 or 10 prescriptions? Who's the best candidate for a medication review?
So across the country, there's different eligibility criteria, and you would need to either visit your Ministry of Health website for that information or speak to a pharmacist about it. In Ontario, for example, anybody who's on 3 prescription medications or more or who has diabetes is eligible for that service. But there again, at the Health Depot Pharmacy, we're not really excluding anybody based on payment. If you have questions about your medication, even if you're only on 2 medications and you want to go over them, we're making that accessible.
So I can, or if I was a patient, I could access a medication review with Health Depot on the phone or online. I don't have to be in a bricks and mortar store to get that done?
Absolutely not. No, those services actually work really well virtually because you're often at home, your medication is there. We can go over everything privately and conveniently for you. We also spend some time looking at medications that you're not using anymore and expired, so we can give you some direction around what to do with those as well.
I'm just looking at some of these great questions coming in from our members. Thank you very much. Interesting one here. Is the training and education of pharmacists consistent across the country? Are all pharmacists alike in Canada?
There's been a lot of work done in the past 2 decades, I would say, to ensure that there is a standard of all healthcare professional education, to be honest with you. And a lot of that has to do with making sure that healthcare practitioners can move across borders fairly easily. All colleges or all pharmacy schools in Canada have to be accredited by their college or other regulatory body in their province, as well as national regulatory associations as well. So the standard of education is very high, and even again, I go back 27 years ago, University of Alberta, I was being taught at a very, very high level, much beyond even at that point my scope of practice. The grads that are coming out today are just so well trained and have so much knowledge and even experiential education as well. They're coming out with really, really good skills.
There's another question here I wanted to get to. It was one on my mind. Can a pharmacist refer a client or a patient to a specialist directly from the pharmacy?
Typically, no, that's not something that pharmacists would do. Now, that doesn't mean that we don't communicate with specialists. So for example, during a medication review, I don't know, let's say you're seeing a cardiologist and we uncover that you're having difficulty with a medication due to a side effect, we absolutely would send a letter to your cardiologist to, provide a recommendation for a change in therapy, as well as your primary care provider. So we don't tend to refer to specialists, but we do tend to communicate within your circle of care. As we've expanded this scope, that's been a main premise to everything that we do.
Okay, so back to the scope then. There are other services that pharmacists do provide, med checks being one of them. What else do the pharmacists do in the modern pharmacy?
So one that particularly with this particular population listening today, we do travel health assessments.
Travel.
So again, at the Health Depot, this is something you can access conveniently, virtually. You're going away somewhere, you want to make sure that do you have all the vaccines that you need to do the travel that you're going to do? What about access to healthcare while you're there? Do you need to make any changes to the medications that you take? Do you need any additional medications for altitude sickness, for example, or to prevent traveler's diarrhea or treat traveler's diarrhea? So that's one service. Pharmacists can look at your itinerary, determine what information we can give you, and secure vaccines that you need in order to travel safely. A lot of people are aware that we can renew prescriptions. I think it's really important to understand that that's not sort of just adding a number of renewals to your medications. It's really about taking the time to assess you, make sure that it's appropriate to continue with a medication, understanding what the risks are if you don't continue with the medication, and then providing refills as needed. I can see a state down the road again where perhaps we're provided with a diagnosis and then we would prescribe. Most provinces, we have the ability to at least access lab tests. In some provinces, pharmacists can order lab tests for patients. Always seemed odd to me that we were responsible for monitoring patients' therapy, but couldn't actually order lab tests for, to be able to monitor that therapy. So that's changing. And then prescription adaptation is another thing that we can do, which is where we look at your prescriptions, and if there's specific characteristics, we can adjust it. Another area that Health Depot is really putting a lot of concerted effort into is pharmacogenomics. That's a really big term, but basically what it means is looking at your particular genetic makeup and the medications that are being used to treat various conditions and trying to find the best match for that. So it's very personalized medication.
Tell me just a little bit more about what genomics means. I'm definitely a layman. What does that mean for our listeners? How would that help them?
So what it means is it's about getting a small sample of your DNA and then analyzing that DNA to see how do you handle different drugs. So what's your absorption characteristics? How do you metabolize these drugs? What receptors are they most strongly interacting with? And then we take that information and we look at your need for medical treatment, and we try and tailor that treatment so that we're using medications that are going to be the best, most effective for you and the least likely to cause side effects or issues for you as well. It's a fairly new area of pharmacotherapy, pharmacy services, but very, very interesting. And we could probably take a whole day just to talk about that.
Well, we certainly will be back with the Health Depot. We want to have a series of these webinars on this important topic of medication and getting the most out of your pharmacists. Another question here about travel. So when someone is planning, the snowbirds in our demographic, being away for a longer period of time, what are some of your tips as a pharmacist for making sure that they, A, don't run out of medications, or B, can get medications while they're traveling?
So first and foremost, it's being proactive. So it's thinking, when are you leaving the country? When are you planning to come back to the country? You do have to work within certain rules. So for example, in Ontario, you can't just carte blanche get medications for a year to leave the country. There are some rules around that. So you often have to work with your pharmacist well in advance to understand how much medication are you going to need. I also always recommend a little bit of a buffer. So if you're planning on coming home on a certain date, I always recommend you make your end date a couple weeks after that, just in case something should happen and your travel plans get delayed. Depending on where you're going, there could be some impact to how you're using your medications. So again, having that information available to you, talking to your pharmacist, finding out what your needs are, or a travel health appointment, especially if it's a little bit more adventuresome travel or anything like that, are good ways to get that information as well. Possibly using things like bubble packs and compliance packs to make it easier so that you can go off and enjoy your time and not be as focused on how to take your medication accurately is another good thing to look at too.
Great. Another question came in, and a question I don't know the answer to, so perhaps you could help us. The difference between generic drugs and branded drugs, and many of our members who, when going to their pharmacist, their payer requires a generic drug. So what does the difference, and what does it mean for the patient?
So it's a lot of semantics, to be honest with you, especially in this day and age where a lot of brand name manufacturers also own or manufacture generic versions of their drugs too. But brand name really just means the original company that held the patent or the manufacturing capacity to produce that medication. In Canada, we have extremely stringent guidelines around the genericization of medication. So ensuring that the generic brand of the medication has the same effectiveness, is absorbed the same way, dissolves the same way, has the same characteristics, produces the same outcomes. Genericization, especially in our healthcare system, is extremely important because it helps to save on drug costs. And without that, our drug costs would be far more out of control even than they are now. But to put it this way, I'm on a blood pressure medication, I take the generic one. Even as a pharmacist that probably maybe has readier access to brand name drugs, I consider generics safe medications to take that help to save our healthcare system money.
Lots of money, yeah. Another question, important question coming in. How long can prescription medication last? In this instance, it's Susan asking about particularly medication prescribed after surgery. So how long can a medication sit on the shelf for?
So every single bottle, every single lot of medication has an expiry date on it. So for example, at the Health Depot, we actually put that expiry on your label so that you have some more certainty. A lot of it comes down to safely storing medication and where you store the medication. I always laugh because the medicine cabinet in your bathroom is the worst place to store medication because of humidity levels and fluctuations in temperature with baths and showers and all of that stuff. There are some rules of thumb we also use. So for example, for a solid oral dosage form like a tablet or a capsule, we typically say 1 year from the date it was dispensed is a good rule of thumb to use. If it's much beyond that, it's not so much that these medications become dangerous, it's just that they lose their effectiveness. Creams and ointments, oftentimes we're talking 6 months. Liquids can be really variable because it depends on whether it's refrigerated or not. Most refrigerated products, 14 days to 28 days is about the extent you're gonna get. An unrefrigerated liquid, we typically also say around 6 months.
In my place, in that medicine cabinet, there are many prescriptions and ointments and creams that are certainly expired.
Yeah.
What is your best advice on what we should do with those? I've heard terrible stories where people have poured medication down the toilet and it ends up in the water system. So,
Yeah.
So what's the best advice for disposing of your unused medication?
Yeah, please don't flush your medication down the toilet or put it down the drain. Don't also throw it in the garbage either. So pharmacists across the country participate in stewardship programs. These programs are often run or supported by the government. And what they do is they help to make sure that there is a chain of return. So when medications expire or are no longer used, it's also not good to keep medications hanging around the house. Even though they may not be expired, they're things you don't use anymore. It's best to get rid of them. Best way to do that is empty everything out of the vials if you can into a Ziploc bag as far as tablets and capsules, liquids, inhalers, creams, ointments. Just try and tear as much of the label off of it as you can and put it on top of that bag. You just don't want your personal health data easily accessible. And take that into the pharmacy and do that immediately. Don't leave that Ziploc bag hanging around where a pet or a child or somebody can get into it. And then pharmacists have a disposal mechanism, and it's as environmentally friendly as it can be for things like this.
Great advice. I'll take that. We've had a lot of stories about the medication system, the healthcare system in the news recently, and one of the most pressing for our members was headlines that said the state of Florida was coming to take drugs from Ontario or from Canadian manufacturers or wholesalers. Tell us a bit about what's behind that headline. Is the medication system in peril in any way in Canada? And what does it mean when the state of Florida says that they'd like to buy drugs from Ontario?
So, I mean, this is all being driven by cost, right? So in the United States, they have some of the highest drug costs in the entire world. In Canada, you know, things like the Patent and Medicines Review Board has really worked very hard to keep our drug prices much lower than the rest of the world. And so Florida sort of has this, and there are other states who are trying to pass similar legislation where they can solve their woes around medication pricing by coming to a country like ours, where we've done a really good job of trying to control that. This legislation doesn't enable, you know, Floridians being able to drive across the border and get their prescription filled in your local pharmacy, or to send their, you know, pharmacy like ours, digital, send their prescription to us and we're gonna fill it and send it to Florida. So that's not what this is about. It is about a distribution level agreement that could occur where distributors of medications, large scale distributors, could sell medications to the Florida healthcare system. There's a lot of practical reasons why that's probably not going to happen. Just because they've enabled this legislation, a lot of drug companies and manufacturers and distributors are not going to want to sell their drugs at a discount in Canada to be used in the United States. So there's a lot happening there that I don't think Canadians need to be worried. The other thing that's really important to understand is in Canada, our health system, Health Canada, has very stringent guards around things like this creating shortages. Companies that engage in any practice that could potentially result in a shortage of a medication because of a distribution level agreement face extremely large fines and penalties, the inability to be able to distribute their medication in Canada. So we have a lot of safeguards around that as well.
So shortages is on my next question, and it's related to a new diabetes drug, or perhaps not that new, called Ozempic. It's been in the news as a weight loss drug. Tell me a bit about what Ozempic is for those who don't understand, me included, and what does it mean when we hear shortages of that drug?
So Ozempic is a newer class of medications that works on a hormonal system involved in digestion and how your body handles the energy, the carbohydrates that come in your food. And it basically kind of modifies that. It does a few things. It increases something called satiety, which makes you feel full faster, or even in some cases, it can make you feel like you don't want to eat as much. But then it also creates some hormonal changes in terms of how your pancreas uses insulin to extract the sugars from the food and distribute it to the body. These drugs were originally designed to treat diabetes, because diabetes is essentially a problem of energy distribution in the body. And in Canada, that was the first and initial indication that this drug had. But like with many drugs, you know, research showed that what happened is people lost weight while they were on this medication. Very important, especially for type 2 diabetes, because weight loss is associated with better control and therefore better outcomes, like less kidney disease and less heart disease. Unfortunately, you know, social media and the entertainment frenzy that surrounded that resulted in a lot of people seeking this medication specifically for weight loss. Drugs like Ozempic in the same family are indicated for weight loss for people with a BMI of 30 or greater. So to put that in perspective, a 5'10" individual would need to weigh somewhere around 215 pounds or more in order to make them eligible or appropriate to treat Ozempic. They can be really good medications, but also like all medications, they're not without risk. So you've seen news reports of a condition called gastroparesis, which is where the stomach essentially stops moving. There's been issues with pancreatic disease and gallbladder disease. Obviously, the redistribution of fat causes some unpleasant side effects, like loss of fat under your skin and your face, making it look, you know, skin sags a little bit more. We even have Wegovy finger now, where people are noticing their fingers getting wrinkly as a result of using these medications. And they can cause some unpleasant things like vomiting or diarrhea and things like that. So they're not. There's some debate about some more significant things like loss of muscle mass or loss of bone mineral density in the skeleton. That's debatable whether that's really an issue or not, because all weight loss is associated with some of that, but these may cause it at a much higher rate, which of course is an issue, because if you lose lean muscle mass, your metabolic rate also drops as well. And studies have shown that if you stop these medications, usually within 6 months rather of stopping the medication, you put most of the weight back on. And that's especially if you've lost the weight while you're on this medication, but you didn't make some dietary changes and you didn't change some exercise habits. And when you think about a drug that can cost over $500 a month to use, using it for a really, really long term is, something that's not going to be possible for a lot of people.
And someone couldn't access that medication without a prescription in the first place.
Yeah,
so you'd have to speak to your doctor about your desire to lose weight, and they would prescribe the best route to that for you.
Absolutely. And so we did see some shortages occurring late in the year and early into this year, where just because of the unanticipated prescribing of this medication for people who were, beyond just the rate of diabetes treatment that we were looking at, did result in some, needing to cut back on how much people could be supplied or what pharmacies had accessible to them to dispense and everything. Those are getting under control now, though.
Another question just came in about healthcare records. So who has access to my healthcare records? I know that different provinces have tried to have online records available, but does any pharmacist have access to my health records? What's the privacy there?
So in Ontario, pharmacists are considered part of your circle of care. So they're one of the healthcare practitioners in your circle of care. And so access to online EMRs, we call them, like the clinical viewers that are available in Ontario, is something that pharmacists can do. We have to follow extremely stringent privacy guidelines, just like any other healthcare practitioner. There's the PHIPA Act in Canada, which really regulates, whose online profile. They have to be a patient that we're providing direct care for. We only have to access the information that is relevant to the care that we're providing. There's a whole host of regulation around that. And the systems themselves are also very, very smart in terms of making sure that those privacy commitments are being met. But yes, other healthcare practitioners do have the ability to access it, and it's all about giving you better care.
Going to put you on the spot here, I think, but a question from Mark about artificial intelligence, and that's a buzzword right now, AI.
Yeah.
Do you see any role of artificial intelligence in the future of pharmacy or medications?
Well, I mean, absolutely there is a role. I think anybody that thinks there's not is kind of kidding themselves. AI is there already, but there's also problems with AI too. I don't think that they're ever going to replace clinicians. I think that they are a great tool that allows us to really consider a lot more about a patient at once, and also really look at the available treatments that are appropriate for a patient. But studies have shown that you still need the intervention of a healthcare practitioner in validating those results and in providing the final say on them. So great tool and everything else, but AI is prone to its own problems as well, and still needs significant human intervention to use it appropriately.
That's good to know. The Health Depot is CARP's recommended online pharmacist, and we've talked a bit about the role of pharmacists, a bit about what online can mean to people, but you also use the term clinical pharmacist. Mm-hmm. And can you just expand a bit more on what that means? And this is really one of the main reasons CARP has partnered with the Health Depot, because it's more than just someone who reaches behind the desk and hands a prescription to you over the counter.
Yeah.
What does a clinical pharmacist do?
So a clinical pharmacist is really about focusing on the patient and making sure that the pharmacist in particular is properly resourced to spend the time and be able to practice at the top of their license, use all of their education and resources that are available to them to provide comprehensive care for our patients. So what we're really trying to do in the Health Depot and in the GreenShield environment is bring a hospital level of care to our patients who are in the community. So it's giving access to pharmacists conveniently, again, from the privacy and convenience of your own home, to be able to have those discussions around what is the best way to use my medication? What problems am I facing with my medication that could be resolved? I'm traveling, what do I need to know about my destination and traveling in a healthy way? I have a minor ailment concern, how can I access that? So it's really about investing in the pharmacist's labor, resources, and tools to be able to provide that enhanced level of care.
Terrific question here. and I'll read it directly. How would you recommend finding a pharmacist best suited to your needs? How is switching pharmacists because of personality, communication, knowledge, etc. viewed? Does switching to find a suitable one raise suspicion in the minds of your pharmacist?
Well, I would say that any pharmacist who has a patient transfer out would be and should be asking themselves why. What was it that happened that caused that relationship to no longer be, considered valuable by the patient. Again, we really recognize at the Health Depot that providing these clinical services, that's what patients are looking for. We can distribute medications and we can make that convenient and easy and everything else, but technology and regulated pharmacy technicians and well-trained pharmacy assistants, that can, we can do that. With clinical pharmacists and clinical pharmacy, I think what you want to be doing is looking for a pharmacy that has your best interest, that can have those conversations with you, that makes the pharmacist accessible to you so that you can ask those questions and get those services that are going to contribute to your health. And does it raise suspicion? Not outside the norm of just, practice aspects of like, why am I losing patients, right? It might cause a pharmacist to step back and maybe think, what is it that people are looking for that I can do better? But for us, it's an opportunity to engage with new people and give them better health care.
If someone wanted to take advantage of the Health Depot for a meds check or speaking to a clinical pharmacist, what would you recommend be their best first step?
Either call us or go online and book an appointment. Go online, you can set up your account and then request an appointment virtually. And then we'll arrange that time. We'll have a pharmacist call you and go over your medications with you and answer your questions. Or you can always just pick up the phone as well and call us. And a lot of times, we're able to transfer you right over to a pharmacist. If not, we'll book a time that's convenient with you to do that and not a week from now.
All the information is available on the carp.ca website, certainly, under our healthcare portal. And encourage everyone to visit and find out more about the Health Depot. So, Drew, I'm going to give you one chance to summarize maybe the final part of our agenda was how to get the most out of your pharmacist. So as a pharmacist, what's your top piece of advice to patients, to clients on how they can best take advantage of everything that a pharmacist can offer?
I think it's about understanding what a pharmacist can do nowadays and understanding that the role has increased and that pharmacists are a really key component of your primary care team. So asking those questions, not being afraid to contact your pharmacist and ask. And if we honestly can't help you, we're at least going to tell you that and we're going to refer you, into the part of the system that can. And just taking advantage of those services, knowing that a pharmacist can help you with your prescription renewals, can go over all of your medications with you on a regular basis, or help in a transition from hospital to home or home to hospital. All of those things, they can assess you for vaccines and tell you what vaccines you're eligible for or should get, and then can administer those vaccines. So just really understanding nowadays what your pharmacist actually can provide and then accessing those services.
Thank you very much, Drew, for joining us here today. Thank you to all of our webinar participants. We have recorded this, so we will share this video to everyone who registered. We'll also send along some information that Drew has shared with us in printed form so you can reference that. And we look forward to having Drew or someone else from the Health Depot join us again for a future webinar. Lots of important information that we can still learn from pharmacists and from the Health Depot. So thank you, Drew, and thank you to everyone who joined us today. We'll sign off for now. Thanks again.